I want you to look at this foot. At first glance, you see the dust of a long day of play, the small scars of a childhood spent barefoot. But if you look closer, right there, beside the nail, you'll see it. It looks like nothing. A fleck of pepper, a stain. It's so small, your eye wants to skip right over it. But I need you to see it, because this tiny forgotten speck is a monster, and it's alive. I'm not using that word lightly. A monster. Its real name is Tunga penetrans, a sand flea. But where I come from, we call it a jigger. And what it does, it's the most quiet, insidious betrayal of the human body I have ever seen. This female jigger, she doesn't bite. She burrows, head first, into the skin. And because she's so small, you don't feel a thing. She picks a place where the skin is soft, between your toes, under your nails, the heel. And then, she makes a home. Inside you, she begins to feed, and she begins to grow. She becomes a factory for her own children, swelling with hundreds of eggs. In a week, she's a tiny white pearl under your skin, and that's when you feel it, an itch that becomes a burn, a pain that starts to throb with every heartbeat. This is the moment you notice, and this is the moment that decides everything. If you have a sterile needle, and you know what you're doing, you can gently lift her out. The pain is gone. It's over. But what if you don't have a needle? What if all you have is a rusty nail, a sharp thorn from the bush? This is where the story turns. The tiny hole becomes an open door. Bacteria floods in. The wound, once just itchy, now swells into a raging infection. The flesh turns angry red, then a frightening purple. The pain is no longer a throb, it's a constant screaming fire. And it doesn't stop at one. I've seen feet, hands, covered in dozens of these things. The skin becomes a landscape of pain. People can't walk, they can't work, they can't hold their children. They are prisoners in their own bodies. The infection spreads to their blood. It poisons them from the inside. And in the worst cases, they die. Not from a jigger. They die from a chain of events that started with a speck of dirt and was fueled by having no other choice. They die from an itch. But I need you to understand the most important part of this story. This ending is not inevitable. It is not a fact of life. It is a failure of care, and it can be stopped. The cure is astonishingly simple. It's a pair of shoes, it's a bar of soap, it's a clean needle in the hands of someone who knows how to use it. It's knowledge. It's looking at that speck and knowing it's not dirt, but a problem that can be solved. This isn't just a medical issue. It's a story about dignity, about the right to live a life free from a pain that should not exist in our world. It starts with seeing the speck, but it ends with us.